I'm Susan Frampton. I'm the president of Planetree International, and I've been with Planetree for almost 18 years now. It's been wonderful, wonderful work to advocate for the rights of patients, also for the rights of staff, and to celebrate the work that they do together. Planetree was actually started in 1978 by a patient, and she had an unfortunate hospitalization. She did not feel like she was treated in a very humane way, and she was very inspired after her own trouble to try to change healthcare for the betterment of all patients. So she started Planetree with a vision that healthcare should be looked at always through the patient's eyes, that we should always listen to what patients are asking us for and to try to work with them to deliver care in a way that's very human-centered, very focused on the human being. Well, I think it's at least as important to a private hospital as to a public hospital. Because one of the things that we know is when you follow this path of creating an excellent patient experience and an excellent staff experience, it makes financial sense. We know from looking at the data that at hospitals that have implemented Planetree, their staff satisfaction, their staff retention is higher. So you're saving money that you might otherwise have to spend if you lost staff and had to recruit more staff and spend money on training. So from that perspective, that makes a great deal of sense. We also know that looking at the data, that hospitals that implement patient-centered care, and especially those that attain the gold seal, are rated more highly by patients and are more likely to be recommended. So if you are a private hospital and you have competition from other private hospitals, then you want to implement a model that is going to satisfy your patients, and those satisfied patients will go out and tell their friends and their neighbors, this is the hospital I would recommend to you. So it's good business. I think, as I said earlier, you've got wonderful leadership, really inspired leadership, and that's where this starts. You have to have leaders who are committed, who understand this, are willing to push themselves and support staff as they have ideas. I also saw some wonderful staff today who obviously love working here, are committed to the organization, and are committed to patients. So you've got the right ingredients. You've put into place many, many challenging practices that patients want. You have a few more that I know you're working on. So I have no question that you will get to the end of that rainbow that I know you aspire to, the gold. I know that you will do that because you've got the right combination of staff and leadership. I think you need to continue to do what you're doing and don't let up. Even when you attain gold, remember, the journey doesn't end there because patients' expectations will continue to change, to increase, and you have to continue to listen to them and to be responsive and to find new and better ways of making sure that they get the help and the support that they need and that they want. So this is, in many ways, when you do get gold, it will just be the beginning.